Okay, so the idea now is to talk about the labyrinth concussion, which is like a blow to the labyrinth. The idea is that think about the temporal bone. If we have the temporal bone right over here, inside we have the semicircular canals, right, and the cochlea right over here. This is the inner ear. If I can draw it, it looks like an ear here. This is the temporal bone. I'm not sure that it looks exactly like this in MRI or CT, but okay. Now in a concussion there is a blow to the temporal bone or the occipital bone, that's right over here, the posterior part of the cranium, occipital bone, and this blow can cause concussion, like blow to the labyrinth. Now very interesting fact is that if there is no fracture line, namely if the blow didn't cause fracture of the temporal bone, there might be, if there is no fracture, there might be even more severe damage to the labyrinth, because the fracture line can like dispose the force that is given to the bone. So if there is a fracture line, this fracture line can reduce the damage that is caused to the labyrinth. So this is a quite interesting fact, that fracture line can literally reduce the damage to the labyrinth compared to no fracture line. Of course, it's a more of a general rule, not, for example, for someone who smashed his cranium. Of course, the labyrinth will be totally destroyed. Now, the symptoms can be a hearing loss and vertigo, vertigo, disequilibrium, as it can damage the hearing loss, the cochlea, and the vertigo, the vestibular system. And usually those patients after the blow have loss of conscience, because the blow should be strong enough to cause the symptoms. So usually those blows can cause loss of conscience to the patient. Now another interesting fact is that not always, let's call it straight, not always the symptoms of vertigo and hearing loss starts straight away. Sometimes it is delayed. I mean, sometimes it takes time until the symptoms start. So it may be that the patient will come back some days later and tell that he started to feel the symptoms. Now what you should look in the, let's call it, the physical examination, is look at the ear canal. It may be normal, but you need to look for findings like CSF or hemotympanum that will tell you that there is maybe a fracture line or a middle ear trauma. For example, blood or CSF may tell you that there may be a fracture, because it tells you that something was broken. Now in audiometry, what you will see is profound sensory neuron hearing loss. Of course it's unilateral because it's in the side of the damage. In ENG, if you won't call it VNG, depends on how you do it, you will see you may see nystagmus without fixation, and the caloric response will be decreased. So let's call it nystagmus and reduced caloric response, which tell you that there is a damage to the vestibular part. CT may be normal, or you may see a fracture line, so it may be normal or fracture in the temporal bone. And the treatment for labyrinth concussion is usually symptomatic treatment, namely treat the vertigo, treat the pain, treat the headache, of course, if there is CSF leak, remember that the patient may have complications, so look for, I don't know, meningitis is a complication, but I'm not talking about this. I'm talking about the treatment for the labyrinth concussion. Usually it's a symptomatic treatment. And it's interesting to see that this damage causes sensory neural hearing loss. I mean that you need to look for high frequency hearing loss. So look for frequencies of about 4000 Hertz to 8000 Hertz, those hertz that are related to sensory neural hearing loss. So labyrinth concussion caused from blow. Usually the patient lost consciousness in the time of the blow, and the symptoms not always starts in the beginning but may be delayed for several days, and it presents with unilateral hearing loss, nystagmus. You may see external ear canal that is normal, but it may also contain blood and CSF that may be associated with the temporal bone fracture. In the audiometry, you will see sensory neural hearing loss that may be profound. ENG will show you nystagmus and reduced or absent caloric response. In the CT, there may be normal or fracture in the temporal bone, and remember that the fracture may, I don't know how to call it, but the fracture may even decrease the blow damage. So the fracture may even tell you that that it helped reduce the blow and the damage to the labyrinth. But if there is no fracture, it may be even cause more damage to the labyrinth. Remember that the hearing loss, you expect it to be in the high frequency, as it is a sensory neural hearing loss. And this is about the labyrinthine concussion. Thank you very much. If there are any mistakes or correction, please tell me, and that's it.